Assalamu alaikum, welcome back. Yes, it is the mid-morning show with me, Julie Alli. This is Salam Media. We're all about humanitarian journalism. Next on the show, Dr. Emmanuel Taban. He is a leading pulmonologist, and he's going to talk to us about, I don't even know where to start. Do I talk about your life story, or do I talk about the amazing work you are doing? Good morning, welcome to the show. I am honored to have you here.
Thank you so much. Thanks for the listeners of the Salam Radio. I feel honored to be talking to your show.
The honor is ours, believe you me. You have an amazing life story. You've been in South Africa now for many, many years. You fled your home country because you were incarcerated. You were really a political prisoner, so to speak, at the tender age of 16. Tell us a little bit about that story. How difficult was it? Were you alone when you were making this epic journey? And why South Africa of all places?
Well, I think, yes, thank you. I think, it was, yes, I was a political prisoner. It was a difficult moment, in Sudan, when there's a war between South and the North Sudan. And that's always been the biggest issue, because it was a political war. And unfortunately, I found myself on the receiving end at the young age of 15, and obviously being taken to North Sudan and being in the Muslim school. And the idea was really not to come to South Africa. The idea was actually to go back to Juba in southern part of the country. And of course, that time I was very young, I was naive, and I thought that I could walk throughout back to Juba about 1,600 kilometers, because for me in life, when you have to go, you have to go. The distance should not actually prevent you from about where you want to reach your destination. And of course, when I left the country, then I found myself in Eritrea, in different kind of country completely. And of course, there also I was in prison for a few months, 4 to 6 months. And then I was released. And then, of course, I was struggling with the language. The language was a big issue. And I needed also, the biggest objective for me was to get an education as much as possible. So I thought maybe the best was to go to Kenya, where everybody speaks English. So, and also we had some relatives there where I could probably get education. And unfortunately, when I went to Kenya, I was not received well, because I think like most society, they don't have enough to cater for people who are not their children. So my uncle couldn't really look after me, so he wanted me to go to refugee camp. And that was a moment that when I had one of a Coca-Cola bottle and I saw made in South Africa, then I can say, you know what, I can as well take journey to South Africa. I just needed to go somewhere as far as possible, run away from everybody, from my problems and from the family, and then to see where I could find myself. And that's when I found myself in South Africa in 1995, December.
How long did it take you to make your journey down south?
From Kenya to here, around 4 months.
Walking all the way?
Walk, and then also I did get a bit of bus. And whenever I got money, I use a transport. If I don't get money, I keep on going.
How did you come by the little bit of money that you did come by?
I've been supported. I got a lot of help from the Catholic missionaries. They were being quite very receptive to me, and they supported me throughout my journey at most instances, yes.
Okay, and then you finally arrived in South Africa. You lived on the streets for a while.
Yes.
And after that, you became a gardener. That's when things turned for you, because the people you worked for as a gardener saw something in you. But tell us just how difficult was it living on the streets? I mean, we see street children all the time in South Africa. It breaks our hearts, but what can we do? You know, you can help 1, 2, 10 people, but as an ordinary citizen yourself, you can only do so much and not anymore. So what was that for you like?
I think at that time, living on the street was not by choice. I consider it as part of the journey. You know, when you're in journey, anything could happen on the way. You can't have a car tire puncture. Unfortunately, you have to fix it. The car might actually stop. Then you might have to get out and sleep there. So I viewed it in that way. Of course, staying in the street is not very easy. It was uncomfortable. You sleep on the pavement. There are a lot of other street kids. and people that are on drugs, and they're very violent. But the difference was that those people, they have mental issues, they have arrived, they're happy where they are. I don't think if you take them out of the street, they will always return back. In my case, I was in journey. I was going somewhere. I was going toward a destination that I didn't know, but I knew that there was a place that I was going to. And that's what kept me going and motivated me. So I never really take that as a major obstacle. For me, it was just a kind of distraction that you get throughout your journey.
What was it that there's got to be something or one particular thing that kept you very focused? Because anywhere along your journey, you could have gotten lost. You could have become a drug addict. You could have, the mind boggles to think where and how hopelessly, helplessly, and frighteningly your journey could have ended. But you were focused. You were absolutely focused, and look where you are today, a leading pulmonologist doing amazing healing, very especially in this time of COVID-19. So what was that kept you going?
I think I would say grit or charisma. Inside us, we have a certain kind of instinct within us, instinct to survive, instinct to persevere. And sometimes, if you get to know yourself, we all having special kind of talent in us. And in my case, I always feel like there's something out for me. And during my time on the street, I've seen the worst part of humanity. I've seen the deepest end of poverty. So, and I couldn't sink any further anymore. I reached to the deep end of the ocean or ground. But once you're at deep end, there's only one way that you can follow. It's going to be upward. And I knew that a moment will come when probably I'm going to start ascending. And yes, indeed, that moment did come when I got the opportunity to go to school. And that was my moment in life that I spent hours and hours reading over and over, never believe that I was not good enough. Despite my poverty, being on the street, I never ever given up. So we all ought to do that in our lives to be able to prosper in life. Life is never easy. Life is made difficult for a reason. That's why Allah created us in a certain way so that we are not created to have things easy in our life. We are created to work, to persevere, and make difference in our society. That's what I believe in.
I'm going to talk about your two families, because undoubtedly the family here in South Africa who gave you that first hand up, I presume you look upon them as family, but you left a single mother with 5 children, your siblings, you left them behind and you made this journey to South Africa. Where are they now? Do you still keep in touch? And they must be so very proud of you.
Yeah, I think yes, I did. After 10 years of my journey, I contacted my family. That was in 2004, and that's when we had the first contact. And I spoke to my siblings. In 2006, December, I went to Juba to South Sudan, and that's when I met my mother for the first time. And it was quite a very good reunion that we had. But the only difference was that I'm not used to different kind of life. I wasn't used to those poverty anymore. So I found my presence in South Sudan was very difficult. It was a difficult, like, when you landed and you crashed and landed, that's how I felt. I just felt like the world, God or whoever has been so unfair. When you look at South Sudan and look where I'm staying, it's too well apart. Of course, previously when I grew there, everything was normal. That was the way of life. Until I've seen better, now you get to wonder what's really had happened. Why are we in those circumstances? Yes, so I'm in contact with my family. My mother died in 2013 with heart problems in South Sudan. Yeah, and one of my brothers. So my 4 sisters still have them. And if you're aware, South Sudan is still engulfed in the senseless war for a couple of years, which based on the greed, based on corruptions, It's wars that should not be fought at first place, because we have leadership problems, and actually we're not even far from Somalia. It's a kind of lawlessness country. So that's unfortunate, South Sudan. Regarding my family in South Africa, which is the bishop, he passed on early last year, 30th of May, from peptic ulcer disease. And of course, I went to Italy and I met my newfound cousins who welcomed me, and I feel very loved. Yes. So at least, though I didn't have a father when I grew up, now I did have a father who actually helped me to be where I am today.
So you were a gardener for this family, and they started a relationship with you. They saw something in you, and they helped you got you to where you are today. You still have contact with them. They are your second family. What do they say about this amazing success in your life now?
It was not a family. It was a missionaries, what we call Comboni missionaries. Yeah. So they've been since then. They've been part of me. I'd stay with them throughout my journey. And my book is coming on the 15th, where I've written quite a lot of details about my life journey and where I am today. Yeah. So we're still in contact. Every year we do I go to see now Bishop family in Italy, where I do attend wedding, where they're having any occasion, weddings or funeral or whatever. I normally do go to Italy for those. And because we're now fond of family, since he passed on, so I represent him as a father, as adopted son. So I get involved in the family affairs in Italy, yes.
Wonderful, wonderful. And may your journey continue being one that is filled with love and sunshine always. You decided then to become a medical doctor, and then you decided to specialize in pulmonology. Why? And I understand that you're doing some amazing work on COVID patients as we speak. So tell us about all of that.
Yeah, I think regarding, yes, so I opted to become a doctor. So it's getting hot here. I opted to become a doctor because I was offered a scholarship to do medicine. And then of course I choose to go and do medicine. And for me, it was one of the best thing ever for me to do medicine. So I did my medicine in Medunsa in 2004. That's when I qualified. And after 2004, I ended going to University of Pretoria, where I did my internal medicine. And then I relocated to Secunda, where I worked for 4 years, 5 years as a pulmonologist, as a physician. And then from there, of course, I have that drive within me that I needed more, that probably internal medicine not good enough. I need to specialize as a pulmonologist, because I've seen most of my patients who were having lung problems. I always have to send them to Pretoria, and they have to do a lot of co-payments, and they have to go far away, and they were just poor miners who work in the mines, and they don't have the money and the means. And that's what drive me actually to do pulmonology. So I finished my pulmonology to 2018. And then, of course, that's when I relocated to midstream. So when COVID-19 actually started in 2019, that's when I decided I need to study, I need to make difference with COVID-19. But at that time, I wasn't aware what actually can I do. And I remember I was reviewing a lot of literature, reading quite a lot, and I was prepared. And when COVID came, of course, you never get prepared enough. And it was quite a nightmare. And I remember that our first patient was from the Lodium, a Muslim community, and she did very well. And quite few of my patients, of course, with COVID-19, few of them end dying because they couldn't breathe anymore. And that was what we have been taught in literature. And that actually driven me to want to see what happened in their lungs. And during the process of actually doing bronchoscopy, that's when I discovered that actually people with COVID-19 indeed do develop mucus plug. And actually most of them do succumb to mucus plug. Though the literature, the world didn't know that, because the world, we were told that patients with COVID-19 do not develop mucus plug. And I think that was not really, it was not factual. And of course, since I started doing bronchoscopy, we end saving quite a lot of lives. And as of today, we did about 3 bronchoscopies already early in the morning. and we remove quite a lot of mucus plug, and our patients are doing well. So today we are one of the top hospitals in South Africa with low mortality and with low mucus, with the high number of patients on ventilators.
So I'd like to think that you're sharing this information with other doctors throughout South Africa and possibly globally as well, because we are losing way too many patients through COVID-19.
I think is the issue, the problem with South Africa is that the World Health Organization initially released a letter that's saying that because of the virus was so contagious that the diagnostic bronchoscopy is not indicated in COVID-19. But what the World Health didn't say was that therapeutic bronchoscopy is not indicated. Okay. And therapeutic bronchoscopy and diagnostic bronchoscopy are two different things. Diagnostic means you do a bronchoscopy to want to diagnose COVID-19. And that was discouraged because you could do a swab or you could do an antigen test. While therapeutic bronchoscopy to remove mucus plug or blood clots or whatever in the lungs, that is actually, they haven't said anything about it. And of course, since we find out that this mucus plug is a problem, the first thing that I share with our ICU group in South Africa, and initially I haven't got a better response. Everybody just telling me that, listen, we agree with you, but we're not going to do it. And you must just stop it because we don't want the public.
Why?
Because the fear of them being infected with COVID-19. That was born out of fear. But the questions that, as a doctors, we are better equipped to fight COVID-19 than the policemen and the soldiers and the others. Because we have the knowledge, we have the capabilities, and I think it is our fight. It's not the fight for the public or the lay people out there, it's our fight. And I think for me, I always find it difficult for me to be losing my patient to COVID-19 unnecessary. And since we start practicing, of course, one of the things that we find out that patients from COVID-19, actually, they needed time. If they're on life support, if you exclude infection, you exclude mucus plug, and you exclude ventilatory problems, they will survive. Whether after a month, 2 months, or 4 months, they'll still go home. We have a gentleman that is staying in our ICU for 4 months and a half. Now he's out of oxygen, he's back to his normal life. So it means people should be having good prognosis if we treat them properly. So it means, yes, ideally, we can't be able to reduce mortality of this patient COVID-19.
Okay, I'm a layperson, you're a medical professional, but what I'm understanding from what you say is that you build up a lot of mucus on the lungs, and that obviously, if not treated, you are going to die. Surely it's common, medical, frontline medical workers should know this. I, as a layperson, understood exactly what you said. So why is it not being used more aggressively?
The issue that I think, the issue again is the fear. It's really, really born out of fear. The question that, look, when you run an ICU, you have to have a bronchoscopy machine. So the mucus plug in COVID-19 that we see is not new. It's just like any other patient with influenza, asthma will have mucus plug. And during their course on the life support, if they have a mucus plug, then you need to suck them out. The only difference between COVID-19 and then the asthmatic or people with other things is that there's no contagious disease. Right. That was the only difference. And then the second thing,
when they extract the mucus plug, I should imagine that it goes down with all the other medical waste and gets incinerated or whatever. So it doesn't, it's not contagious or other people can't catch.
It's not. What happened that we take the mucus plug actually, and removing the mucus plug is one. Second thing, we send them to laboratory, analyze for infection. So that means you can initiate antibiotic earlier. So you don't wait for a patient to become septic. You can pick up that they have certain bacteria and you can treat. So there are a lot of positivity toward it. So the questions about people mentality that need to be changed. And the issue that actually you cannot run an ICU if you cannot do bronchoscopies. You have to do bronchoscopies and we know now for the factual that patients put on life support, they should not die. If they die, means they have mucus plug or they're having underlying infection.
All right. What about people watching us this morning and have a loved one that is really very sick with COVID-19 in hospital, their situation hasn't changed or is worsening, can they then ask the doctor to please intervene and please get someone to support them with this facility, this therapeutic bronchoscopy, as you're talking about? And if the doctor doesn't, are doctors aware of this? And if they're not aware of it, can they possibly ask someone like you to please guide them in getting this set up in their ICU units?
Yeah, I think the issue in South Africa that we have a very few pulmonologists. That's one of the biggest problem. But of course, we do having cardiothoracics, and we do having the intensivists who could do bronchoscopies. And yes, I think for me is that anybody that was doing well on life support and it started getting worse and worse, I just think that you need to do bronchoscopy. Now, if you find that the lungs is clean, there's no mucus plug, that means you're dealing with other things like blood clots, or you're dealing with other things like pneumothorax or infection. Then you can have direction how to treat these people. Yes, I think that you have to have a will for training. We can even have centers where we could do those bronchoscopy, because some of them is portable. You can carry them in the hand like a briefcase, then you go to one hospital and do them. That all can be done. But you have to have the will, and the government need to weigh in, because we need to be able to save most of our people. And the real that when we decide to put you into life support, we're saying that you have a very good outcome. We don't put people who are dead in life support. We put people with a good outcome. And if you do that, then you must go all out through the way to make sure they survive.
So this is good news for South Africa. As far as we're concerned, there is a light at the end of the tunnel with this therapy in place. We can request it from the doctors that are attending to our loved ones to please check this out. The other issue that doctors are dealing with is the oxygen saturation levels in the blood. How does this tie in with what you're doing?
The issue that I think, because COVID-19, what it happened, that it affects your lung, what you call endothelia and epithelia. And when your lungs involve more than 50%, then your oxygen level drops. Okay. And when your oxygen level drops, you always encourage the patients to lie on their tummy, because what happened that COVID-19 tend to affect you on the periphery of your lungs. So and also on the back side. And when you lie on your tummy, that increases the oxygen level. So yes, oxygen is the first treatment for COVID. So it means those patients need to be put on oxygen when their oxygen drop below 90. So they need to be put on oxygen. And failure to do that, the oxygen can drop to dangerous level below 50, and most of people would die. Okay, that's the people that when drop below 50, then those people that end up on life support. But some people, just by lying on their tummy and drinking enough water and giving them blood thinners, they improve dramatically, especially those with no underlying medical problem like diabetic, overweight, and hypertension and heart problems. So they will do very well. So in fact, 81% of the population will have no problem with the oxygenation problem. Only 10% will have issue with oxygenation problems, and 4% would end up in ICU. So out of the 4% that end up in ICU, almost 50% of them might die actually from the mucus plugs.
So the doctors need to look for mucus plaque, obviously.
Yeah,
All right. Having said all of that, you've given us a good overview. Your advice to people watching us this morning, how should they be conducting themselves? What supplements should they be taking just to protect themselves from not getting the virus, the COVID virus? You know, there's lots of stories going around, lots of protocols that people are suggesting, and you must have heard of this as well, the ivermectin story that's going absolutely viral. Your thoughts on all of that, and what's the best piece of advice you can give us?
Okay, just going back, I think I remember that initially before ivermectin, there used to be Randasaba. That was the first medication that was thought to be a good medication for treat COVID-19 mild to moderate. And on my practice in mainstream clinic, I found that it doesn't work. So I never used it once, and I never prescribed it again. And
sorry, what was the name? Just repeat the name for us.
Randasaba.
Oh, yes, of course, yes, we've heard of it.
So it never works, so I never use it. And ivermectin also, it got a lot of side effects, and it's support indicated for mild to moderate. and the evidence are not very good enough, too much toxicity, I don't think there's evidence for that. And my advice that any medicine that is meant to treat mild to moderate COVID-19, most of the time it's like placebo. Because those patients, mild to moderate, they have no problem. They will recover fully. What we need medicine for those that are on a life support. And currently, none of the above medication can actually save those kind of people. So I don't think ivermectin is actually the gold changer here. And I don't think the studies are that credible. And I don't think that that is one of the best. Toxicity levels are quite very high. So I'm not in favor of ivermectin unless they have come up with a very good studies. At this moment, I'm not convinced.
Okay.
So,
yes, carry on.
And then regarding like people, advice to people, of course, the first thing that everybody, especially if you have diabetes, hypertension, overweight, and also underlying heart problems, you need to look after yourself. You need to do social distancing. You need to wear masks. You must sanitize all the time because your outcome is worse as compared to somebody of the same age with none of the above. So people need to take precautions about it. It's very, very important that they cannot live their life like other people. If you have this, please stay out. You can apply to your work and get to work from home. And because life is too short, and currently the hospital capacity is full. So it's very important. And apart from that, once you have diagnosed with COVID, yes, the best vitamin I'll tell you is water. Hydrate yourself properly because patients with COVID, they tend to be dehydrated. That's why in the past they were told that they go into kidney failure. But if you hydrate yourself properly, you will be okay. And the second thing, learn to sleep on your tummy. That's a good game changer. Number 3, if you got COVID, please buy a SATS monitor. Takes your oxygen level. If you drop below 91, below 90, please go to the hospital, get some help earlier. Don't wait till late. And number 4, vitamins that they talk about, vitamin D, zinc, and vitamin C. They say it works. I just think it's placebo, but there's no harm to it. You can take it. That I don't have problem with it. But the most important thing is the behavioral change. And COVID-19, even though you have COVID before, you can get the second infection, which can be severe. So please, doesn't mean that you have COVID before, now you can misbehave. You need to be able to protect our elderly people at home, and that's very important.
Finally, your thoughts on the COVID vaccine, because people are divided about this. There are lots of people who believe that taking the vaccine is going to change their DNA. Your thoughts?
I think it's absolutely rubbish.
Okay.
Vaccines is a game changer. Yes, I agree that the vaccines, you know what, we've been waiting vaccines for a long time for other diseases like HIV and all those, and they're not here. But for COVID-19, we're getting vaccines very quickly and very soon. But I don't think there's any relation to the DNA alterations. Okay, vaccines are always very good. It's just like influenza vaccine and all those. It's just those are conspiracy theories, and people should not be believing on them. So if you have risk factors, please wait and get your vaccines as soon as possible. Don't live on the conspiracy theories. People are always there. Those who always want to cause chaos, they want to see other people die suffering, and it's not necessary. So vaccine, 100% support the vaccine, that everybody need to be vaccinated. And that's, for me, is a game changer. And because I think we're suffering economically, socially, because of this COVID-19, the sooner we make it disappear, the better. And that's only will happen through the help of vaccine.
Okay, and this is definitely my final question. You've given us a few pointers to follow: social distancing, masking, washing of hands, etc., etc. What about steaming regularly? We're hearing that there's a World Steam Day. Steam, steam, steam. You'll get rid of all the viruses at the back of your throat, at the back of your nose. Your thoughts?
I think that's questionable. It's very questionable, and it's not evidence-based.
All right.
And I don't think it's caused any harm either. So, you know, it's like, that reminds me of former Minister Mante Sabalala about beetroots. It doesn't cause harm. You know what I mean? So I think if you want to steam, please go ahead. but please make sure that the whatever you're steaming with is clean, that you're not getting infected yourself.
Absolutely. Dr. Emmanuel Taban, it's been an absolute pleasure having you on my show this morning. I'm going to be looking out for the book and perhaps have you back on air to talk about the book and just how cathartic that might have been. Because you've truly risen against all odds. But I have no doubt in my mind, you also had some horrific experiences along the way. So we will talk some more. God bless. Thank you indeed.
And thank you. Just final word to the listeners. I want to tell you that my story is not unique. We all having that ability in us, and all of us need to fight and raise up, because South Africa needed people that are very resilient, tough, and that want to make difference. Let's all of us try to make difference to our society and to our country. Thank you.
God bless.
Bye-bye.